Hello friends, my name is Dr. Ravinder Singh Rao. I'm an intervention structural cardiologist associated with Lilavati Hospital, Mumbai. Today we will talk about transcatheter aortic valve replacement, which is also called as TAVR and TAVI. Let me tell you, back in 2012, in US when I was practicing, this therapy was only for patients who could not undergo open heart surgery. Now it is a very well established treatment. Even for patients who are fit to undergo open heart surgery, TAVI is better than open heart surgery in terms of quality of life and complication rates. So what is TAVI? In TAVI or TAVR, we replace the patient's heart valve without opening the chest, without surgery, by going from a groin vessel. We go inside the patient's heart, put the new valve starts functioning immediately, and patients stay in ICU for 1 day, and they stay next couple of days in the room where they walk and they rehabilitate. TAVR therapy has done a paradigm shift in the way we treat these patients with aortic stenosis. At Lilavati Hospital, let me go a step further and talk about safe TAVR treatment. We have devised a protocol in such a way that our outcomes are better and safer for patients who are suffering from severe aortic stenosis. At present, even in the US guidelines, and that is what we are practicing, TAVR is applicable for all patients above age of 65 years if they are suffering from severe aortic stenosis. In younger population, like this patient, for example, who was a 27-year-old pregnant lady who could not undergo surgery, we did a TAVR, she delivered a baby girl, and then she's living a healthy life. So below the age of 65 years, only for patients who are not fit for surgery, we would do a transcatheter aortic valve replacement. Otherwise, TAVR procedure, the valve is replaced without surgery by going from the groin. It is a boon for patients who are suffering from severe aortic stenosis. To know more, keep following on Lilavati Hospital website and social media. Thank you very much.